An updated quarantine policy in Missouri schools will now allow students and staff to stay in school even after being identified as a close contact to someone with COVID-19. The new policy announced this week by the Department of Elementary and Secondary Education. We spoke with the St. Joseph School District to find out their thoughts on the new state guidance. Missouri schools have a new option to limit COVID-19 quarantines.
It's great on paper, but then how are we going to make it work in this particular community?
Newly released guidelines from the Department of Elementary and Secondary Education allow students, teachers, and staff identified as a close contact to stay in school and participate in extracurricular activities if they can show multiple negative test results. It's called Test to Stay. Health officials with the St. Joseph School District can see the perks to the updated policy.
I'm not a fan of sending well kids home anyway, so I do see that we could potentially keep more kids in school.
But say logistically, it looks messy.
What they're asking is that kids be tested at least 3 times in their quarantine period, and if they are in an activity like a sports activity, then they get tested on the day of that activity. So what if that activity is on a Saturday night? You know, there's just so many things to work out.
Along with requiring exposed students and staff to undergo rigorous testing, they must also wear a mask in school and remain symptom-free in order to qualify. Those exposed to the virus from home do not make the cut. District health officials worry the sheer amount of testing could place a bigger burden on school nurses.
Currently we test, but we use tests that are given to us by the state, but we do it in one central location through our clinic at Cardin Park. Now they're more or less stating that every nurse should be able to test in a school setting. What kind of effort will have to be put into that when they're already seeing kiddos, a lot of kiddos?
The decision to implement the update lies in the hands of local health departments. The St. Joseph Health Department and the district say they're just in early stages of discussion.
Before I get into action, I want to clarify some things. I just think that's the safest way for us and our parents before we again do something new.
District health officials expect to know more by the beginning of next week on whether this policy will be implemented. For a link to the updated guidance, follow this story on our website, kq2.com.